Stratified cuboidal epithelium is rare in the body. Most of them form the lining of lumen, which is a space within a tubular structure, and the lining of developing ovarian follicles, which is part of the female reproductive system, and the seminiferous tubules, which is part of the male reproductive system. These tissues are also mostly located in the lining of large ducts, such as mammary ducts, sweat ducts, salivary ducts, and the pancreas. They mainly serve as protective tissues. This is a picture of a sweat gland. The circular space in the middle of the cells is the lumen. As you can see, the cells have a pretty similar shape with one another, but are composed of more than one layer. Stratified columnar epithelial tissues are also very rare in the body, but they can be found in parts of the male urethra and parts of the pharynx. It has a unique structure. Since it is stratified, it is composed of multiple layers. However, only the superficial layer, or apical layer, contains the elongated columnar cells. The layers of cells underneath have a cuboidal shape. The location and structure serves the stratified columnar epithelia's functions of secretion and protection. On the right, there is a picture of a salivary gland duct. The hole in the middle is called the lumen. The dark pink ovals surrounding the lumen are blood cells, and the blue dots are the nuclei. As you can see, the cells closer to the lumen are longer, and the cells closer to the basement membrane are more cubical-shaped.
Glandular epithelium is a certain type of epithelium tissue. It is striated, meaning it consists of more than 2 layers of cells. Its name means small gland above the nipple. Glandula means small gland in Latin. In Greek, epi means above, and theli means nipple. Glandular epithelium is made up of cells that secrete. These cells must be secreting cells because the glandular epithelium covers secreting organs in almost all major glands, which secretes hormones such as the hypothalamus and pituitary glands. The glandular epithelium also lines the intestines, where it helps the intestines reabsorb nutrients such as proteins. Glandular epitheliums do not have intercellular space. They do not have space between the cells. The cells are packed tightly like a wall of bricks. Since they line vital organs and glands, such as the kidneys, the cells must be strongly put together. They secrete things with the help of enzymes, and they do not allow for unwanted substances to enter. The cells are rounded and cube-shaped and made up of many layers. The cells have a single nucleus and nucleolus surrounded by cytoplasm, and they go through mitosis to replicate. These cells help in reproduction by secreting sexual fluids that aid in pregnancy. They also help with the process of digestion by helping the intestines absorb nutrients such as protein and iron. The picture on the left is of a glandular epithelium connected to connective tissue. This picture shows how goblet cells are sometimes embedded in the ducts. You can also see how the cells are packed very tightly. The second picture is reinforcing that idea that cells are packed tightly and that there is no intercellular space, and it shows the uninucleus and the rounded cube structure. Transitional epithelium is also a type of epithelium tissue and is two-striated, being of multiple layers of cells. The name of the tissue is related directly to its function, which is to make transition from slat cells to round cells and vice versa. Some organs may need a bit of flexibility, and this tissue allows for it. For example, when your bladder fills up with water, you have an urge to pee, and you sometimes say your bladder is going to pop. It's a possibility if it's filled for too long, but 5 minutes in the car, your bladder is fine. The transitional epithelium cells around the bladder give it flexibility. These cells are important, especially in daily life. Transitional epithelium tissues are usually found in hollow organs, such as the bladder, and organs that have a likelihood to change, again, like the bladder, which is constantly filling and emptying. The cells are changed depending on the organ's need. When the bladder needs to be stretched to hold water, the cells themselves stretch. Although the transitional epithelium tissue is found in the bladder, it is mostly found in the mucous membranes in the bladder. When the bladder is contracted and closer together, the layers are seen, but when the bladder is stretched out, not all the layers are seen. It's the same concept of when someone wrinkles their skin, their ridges form and they aren't seen when the skin is relaxed and stretched out. The transitional epithelium tissue structure is very important. It is relative to its function. If the cells were not able to change, the transition would not be able to take place, and the function of relaxing and contracting the cells over organs would not be accomplished. This picture of transitional epithelium tissue is next to the ureter that contracts and relaxes around the ureter.
Diseases and disorders. Ovarian epithelial cancer. Cancer cells are being formed in the epithelial cells of the ovaries, which can spread to the pelvis and parts of the abdomen. A patient will feel discomfort in the abdomen and pelvis or pain. They might also feel bloated or constipated. There are several tests that can be taken to check if women have ovarian cancer or not. A couple of them are barium enema, which is when you have a liquid that contains barium and it's put in your rectum, and then when an x-ray is taken, it glows in a way. And then a CT scan, also known as a CAT scan, is detailed pictures of areas of the body in certain angles. A biopsy is the removal of tissues or cells that can be viewed under a microscope so a pathologist can check for signs of cancer. An ultrasound is a high-energy sound waves being bounced off the internal tissues or organs, and it makes echoes. Those echoes form a picture called a sonogram. Now, often there is family history of ovarian cancer, possibly, and if you are a first-degree woman or if you're a woman who has first-degree relative with ovarian cancer, so that would be if you have a mother, daughter, or sister with ovarian cancer, you have an increased risk of having ovarian or developing ovarian cancer as well. But if you have a relative like a grandmother and aunt, that's considered second degree. And you're not as much as a risk, you're not as much as a high risk like first degree, but you should just check just in case. There are a couple of factors that really affect what treatment options and the chance of recovery that you have, aside from the stage that you might be in. But some of them are the stage of cancer, like I mentioned before, the type and size of the tumor, the patient's age and general health, and whether the cancer has been diagnosed or it's reoccurred, saying it's come back from when it was previously gone, like when they had treatment beforehand. So there are four stages, and it depends on where the cancer is found and how far it has spread through the body, and that tells you what stage you're in. The first three stages get divided up into three more individual stages from there that go more into depth of information and the type of cancer, where it's spread to, and what's going on. Stage 4 is when one or both ovaries has metastasized beyond the abdomen to other parts of the body, which is not good, because stage 1 through 3 stays within the abdomen, your pelvis, and your ovaries. Stage 4 goes beyond and goes into the lungs, liver, lymph nodes, and bones. With that, there are several treatments or cures, whatever you want to say. Surgery is one of them, and you can women can get total hysterectomies, which is a surgical procedure to remove the uterus and the cervix. A unilateral salpingo oophorectomy is a surgical procedure to remove one ovary and one fallopian tube. So a bilateral salpingo oophorectomy is the same thing, but it's removing both of them. An omentectomy is the removal of the omentum, which is a piece of tissue lining in the abdominal wall, which is where cancer can grow to. Or a lymph node biopsy, which takes out parts of maybe an infected lymph node. There's also radiation therapy, which uses high energy x-rays, and it's either external or internal, Internal uses catheters, needles, wires that are placed directly into or near the cancer in the body. External uses a machine outside the body to send the waves in. Chemotherapy is another one, and it can be taken by there's systemic chemotherapy and regional chemotherapy. Systemic is when you consume the drug, when you consume it and it's flowing through your bloodstream. Regional chemotherapy is when the chemo is going to be placed directly into the spinal column, into the organ, body cavity, wherever it will affect the cancer cells, and it will just affect that one area. And then a lot of the options of these treatments depend on the stage. More than likely, surgery is the best way to go, but it just determines on the stage you're in and like your condition and like your age. It goes back to the factors. Now, with intestinal epithelial dysplasia, it's a rare disorder where a newborn child will develop severe chronic diarrhea soon after birth. And unfortunately, the only way to treat this very rare disorder is that the baby will be put on a long-term parenteral nutrition, which is food, what they need to live, survive, because they can't digest food on their own. It's placed in an IV and placed in their body systems, or in their digestive system, so that way they're getting the nutrients, they're getting what they need to keep on growing. And then aside from that might lead to an intestine transplant to help them in the future for the damaged intestines from the from the disease, not lack of anything, but just the disease in general, this disorder, so that it's possible that they might need an intestinal transplant.